Welcome back, everyone. Hello, hello.
Hello.
Hi, Noreen. Since you bravely unmuted and said hello, how are you?
I'm good. How are you?
Good.
Getting ready for a new day. Just give me a bit.
Absolutely. Jamie, I feel like you should unmute and say that. I mean, it's fine in the chat, but it's better in person.
Welcome, guys. I tried to wear some spicy earrings for you today to zhuzh it up a little. Welcome. Jandria, I'm so glad to have you.
You know, I changed my name actually with the Zoom report. It says Jandria from yesterday. Maybe I'll put it in parentheses today. I don't want to mess with the, tracking of activities.
I'm telling you, I really like Jandrea.
Jandrea. I think the je too, like the sort of
Yeah.
French pronunciation.
Mhm.
But then it's not a Jane, it's not like a Jamie or a Jane. I can't do ja.
True.
It defeats
True.
the purpose.
Clearly, Jane, you have class, and I'm from Missouri.
I don't know if I can pull off Jandrea either. I feel like I'm more of a Jandria. For those of you who have no idea what we're talking about, it's absolutely fine. We're just being silly from yesterday.
Andrea logged into our meeting this morning as Jandrea. But Jandrea has logged into your.
All right. Well, thanks to all of you who are able to join us today. I know most of you were here yesterday. Some of you are only here today. There are some folks who were here yesterday who cannot be here today or have to leave early. And we understand that. We so appreciate when you let us know about that. It just makes us feel good, and we really do appreciate it. So thanks. So without too much further ado, I think we should go ahead and get started. I'm going to turn it over to, I'll see if you can pull up the slides, and I'm just going to turn it over to Clemens for a quick welcome, and then I'll make a housekeeping note, and then we will jump right in.
A warm welcome to all of you again. Clemens Steinberg again. I'm here, the director of CQII, and I want to maybe emphasize that we, as CQII here, which is housed at the New York State Department of Health AIDS Institute, are very glad that 2024 will be the year that we have been continuously funded for 20 years, which is a big milestone for us. One where we hope that we have been value added to your efforts in improvement. Hopefully we set the tone nationally. And so thank you for being part of our journey. Hopefully we made a measurable difference in the way how quality improvement was implemented nationally, but also how it improved, hopefully measurably, the care for people with HIV. You will hear a lot of things coming up. We will change our logo around. We have a lot of activities coming up, including a QI challenge that we will announce very soon. So I hope when you see the email, join us. It's we want to celebrate with all the Rhine-Wide partners around the country to really learn from that. More to come on that, but I want to give you a heads up on that. I don't want to steal too much time today because I know we have a busy agenda. I'm just trying to figure out, Julia, should we do the introduction now? For some reason, I couldn't check while speaking whether our colleague is here today.
I think we're going to hold off a bit, Clemens, until closer to the portion of the agenda in which our special guest will be here.
Wonderful, thank you. Back to you, Andrea, and welcome everyone.
Thanks, Clemens. Yeah, so just a quick housekeeping note. We had an incident yesterday where someone was inadvertently removed from the meeting by CQII, and they could not join back in because Zoom does not allow you to join back in once you're removed. They were meant to be moved to a different breakout room. They were accidentally removed from the meeting. And we debriefed about the whole meeting yesterday, and we feel very bad about this. This was obviously not our intention. It prevented this team from participating in an activity. So we really are trying to take it as a learning and improvement opportunity. So we did a couple of things. We changed our Zoom settings. So I think the Zoom default setting is if someone is removed from a meeting, they cannot rejoin. But one of our wonderful staff here was able to figure out that we could change that setting. So if someone is removed, they can rejoin. And we also decided that it would be good practice to kind of have a technical difficulty contact person so that anyone who has an issue like that knows who to reach out to so that that person can support in real time in the moment and help address the issue very quickly. The person who was removed sent an email, tried to reach out, but the person who they emailed was busy facilitating a session and couldn't help. So I'm just putting in the chat. I did add it to the email that went around yesterday. We've added it to our agenda.
Andrea, you muted.
I know I muted myself instead of chatting. Sorry, y'all. Thank you, Megan. So Asia Khan, our administrative aide at CQII, that is her cell phone number. That is her email address. So please, if anyone has an issue like that, obviously, if you're still in the meeting, you can just chat us and like throw it in the chat if you're having an issue. But if you ever find yourself where you're outside of a meeting trying to get in, for this meeting, please contact Asia. And then, we'll try to do that for all of our meetings going forward. Remember to have a kind of emergency contact for any issues that come up in real time. So we appreciate the site's grace with us and understanding, and genuinely apologize that they missed an opportunity yesterday. And we move forward. So speaking of moving forward, next slide, please. All right, so we went over the Zoom functions yesterday. I don't think we need to go over that again. Again, we will be recording. We will also potentially be doing some screenshots. If you do not want your image included, please let us know. You can always withdraw consent at any point in time. We'll just go over the agenda for today. So we took a vote yesterday at the end of the day about if we wanted 2 15-minute breaks or 1 30-minute break, and the 2 15-minute breaks won. So we are going to keep it with 2 15-minute breaks. So after this little section here, we're going to jump right in with the didactic on communication and knowing your audience. This is a theme that we touched on yesterday that we're going to go into in much more detail. Then we're going to have some Know Your Audience breakout groups where you will get to choose which audience you want to focus on. And you'll actually get 2 options. So it's going to be an hour-long session. And for the first 30 minutes, you can go into one group. And for the next 30 minutes, you can go into the other group. So if you have more than one person here, we encourage you to sort of divide and conquer and cover all the groups. We'll have a little break. We'll talk about sustainability. We'll have another little break. Then we'll have some PDSA work plan breakout groups where you'll go with your coaching group that you usually meet with monthly. And that'll be the second table in your LS5 pre-work for those of you who were able to get to that before today. We'll talk about the plan for going forward, including a talk about some communication tool that I'll be working on collectively until June. And then we'll wrap it up. So I feel like if anyone has any questions, obviously, again, this is not meant to be a lecture, sorry. So I'm gonna pause now and see if anyone has any questions, suggestions, comments to make before we kick it off with the didactic. Just scrolling through some faces to see. All right, if no one has anything to add, then next slide, please. Excellent. So yeah, I'm just going to turn it over to Jamie and Amanda to talk to us about communication.
All right. Thanks so much, Andrea. I'm going to go first and then I'll hand it over to Jamie. I'm really loving Jamie's dangly earrings. I think we kind of coordinated, but I missed the dangly earrings. No. So let's go on to the next slide. So we're going to talk a little bit about communication and quality improvement. And you may be asking yourself, well, why are we going to do that? Amanda, quality improvement's about data and changing things. It's not about how we talk to each other. That doesn't matter. It's not true. So if you have not read this book, I highly encourage it. It's an easy read. It's a fun read. And it is true. It rang true to me. We are all in sales right now. Not in the way that you might think of. So we're not all creepy used car salesmen, but we all are asking for something. And so in doing that, this book really differentiates between irritation and agitation. And I thought that this quote was really nice in the book because it says, irritation is challenging people to do something we want them to do. And agitation is challenging people to do something they want to do. Why does that matter in quality improvement is because if we keep saying you have to fill out this form, you have to check this box, you have to try this new process, that's just causing irritation. Now, while I can't see everybody's faces, I'm sure if I could see your face, I would see that you've worked in situations where irritation is all around you, right? Nobody feels agitated where they feel like they get the chance to do what they want to do. They feel irritated because they're constantly being told what to do. So he just, in this book, they really discuss leading with your ears instead of your mouth. So trying to elicit from people what their goals are for themselves and for their work and having some flexibility. Now, we've talked about that a lot in testing ideas from a small scale. But as we continue to think about growing this work, now that we've kind of begun the process, now it becomes even more critically important. So let's go on to the next slide. Oh, one more slide. Okay, so in the beginning, it's been you at the bottom, right? Maybe you and those two little branches at the beginning. So this is where we've started. Now, just much like in quality improvement, we've been talking about exponential change. So try it for one person. If it goes well, try it for two. This theory is equally important when it comes to going from you as a very small quality improvement team, or maybe even a team of one, which we hate to see, but we know often happens. How do we slowly, exponentially grow the work that we are doing so that it is not just Nurse Jackie's pet project? It is instead the way we do business at Main Street Clinic. So communication is going to help us get there, while the ideas also help us figure out, is this really better or is it not better? Should we be doing things this way? So let's go on to our next slide. So I'm going to talk about the diffusion of innovations. Anybody who's spent more than 5 minutes with me will know that I have a passion for this book and for this model. I am going to quickly try to see, has anybody heard of this by using the reaction or typing in the chat? Please say yay, nay, thumbs up, thumbs down. Anyone? Michelle has heard of the diffusion of innovations. Christina, William, nope.
I
Not
see
seen a whole
Kelly
lot.
with a thumbs up.
Kelly with her thumbs up. All right. All right, so a couple of people. Now I will take comments on the whole book, but it is a thick read. And so before you commit to the entirety of the book, try some of the shorter summaries of the diffusion of innovation and start with this model, or the way we're going to talk about it today. What this model really looks at is how do we get a new idea into the mainstream, into just the way we do business. And it breaks the standard bell curve into innovators, early adopters, the early majority, the late majority, and the laggards. So let's go on to the next slide and we'll talk about what are some of the characteristics of each of those areas. So the innovators are those dream realizers. They're driving for change. They aren't afraid to fail. They explore new iterations. They have a high tolerance for risk. These are the people who were standing in line waiting for the first ever iPhone. Do you know those people? Are you those people? I was not that person. I was in the late majority when it comes to the iPhone, and I'm going to use that as an example over and over again. But these are the people who go out for adventures. They want the newest technology. They need the brand new release of some sneaker. They got to have it. Now, it's not everybody, right? It's 2.5% of our population on an idea is an innovator. And then we've got those early adopters who do really embrace change. They want to see some self-efficacy, and they like to be the first to try, buy, and engage, but not the very, very first. They're kind of right on the cusp. They are often influencers, but not in the way that so this book came out long before the word influencer is what it is today. So not in the way that we might think of the word influencer, but they are those people that you can think about that you work with, that if they buy in, people pay attention, right? It might not be a leader. It might just be somebody who's been there for a long time. People respect him or her. And so they influence everybody around them. And then they're the early majority. And I am happy to put myself somewhere between the early majority on most things. So pragmatists really want to accept change sooner than the late majority, but really wants to weigh the pros and cons. These are the people who need to kind of continually see that things are happening, but they're interested in change. And they really help to gain mass appeal. So we're going to talk about this in the next slide. But once we get into the early majority, the change is kind of out of the gate. The likelihood that it's going to spread is highly, highly likely. But this group, the early majority, really wants to wait until it has been successful. So they've seen some success. And then you have your late majority. And often when we think of change, when people say change is hard, change management, people don't want to change, people don't want to do this thing, we only think of the late majority and most importantly, the laggards. So your late majority are your skeptics. They accept change later. They really kind of have to be poked and prodded out of necessity, not choice. So when it becomes a mandate, then they'll do it. But they go along with their peers for the most part. So they're kind of just pretty quiet in general. They weren't the first to try new ideas, but they're also not standing up and loudly saying, absolutely not, I'm not doing it. Then we have our laggards. And in all honesty, this 16% is what gives us change PTSD, right? That one person who sits in a meeting and says, absolutely not, they throw a fit. They are, and you know, they are change adverse. They are not leaders. They are very suspicious of change. They often wait until they are being forced. So all of those reprimands that we think of only really influence this last 16%. Like we've missed most of the curve coming up with consequences for just 16% of our population. What makes the late majority and the laggards different is that kind of noisiness, in the sense that the late majority will go, like they weren't the first to say yes, they may have been passively resistive, I like to call it, like they didn't show up for the meeting and they didn't fill out the form correctly. They put their, you know, they did a couple boxes and not all of it, but they eventually get on board. Your laggards are vocal about your change, and so we remember them for that. Now let's go on to the next slide. So when you look at this book, if you have an opportunity to, one of these quotes really stands out to me. The part of the diffusion curve that is about 10% to 20% adoption is the heart of the diffusion process. After that point, it is often impossible to stop the further diffusion of an idea, even if you wish to do so. So even if it was a bad change, even if that new template wasn't successful, once you kind of get past that early adoption into early majority, it's often hard to pull that train back into the station. Why does that matter for quality improvement? Because we want to really test our ideas and make sure they're good before we move into the early majority. But then when we start to kind of get some traction, we need to have confidence to know it's going to work. Like the train has left the station, and the likelihood that we're just going to continue through this curve is highly likely. Now, this isn't just his opinions, it's based on research and evidence. So it matters at this point because you might be in your project thinking, this is frustrating. You know, I've got a good handful of people who are willing to help me, but you're focusing your thoughts on your late majority and your laggards. And I'm just here to ask you, please don't. There are some laggards in your organization that you're never going to bring along. They're going to quit. They're going to be fired. They're going to survive. I don't know. But you know what? It's maybe 1 to 2%. The rest of everybody else is going to come along with you. So let's go on to our next slide. So if we think about how do we do that? How do we get over from that 10 to 20%? How do we move into the early majority? What Rogers says is that it really comes down to 5 things. Relative advantage. Does what you offer to me seem better than what I have? So when the iPhone came out, did it seem better than my little Nokia thing that lived forever? I think I still have one in a drawer somewhere. Yes, it did seem better. Did it seem simple though? No, the simplicity didn't really seem there for me at first. So how simple does this idea or change seem to be? Is it compatible? Is it compatible with my daily life? Is it compatible with my work routine? Does it feel like something that just, yeah, I do it this way currently, and I could probably do it that way. It's not that bad. Can they try it? So that was actually one of the big obstacles to overcome with smart devices was trialability, because a lot of people didn't have a couple $1,000s to drop into a phone that may work and may not work. So trialability, the ability to kind of do it for one day, but not commit to the change, is really important to the rate of adoption. And then observability. Do I see my colleagues doing it? Do I see that everybody's got an iPhone? So now I feel like I need an iPhone. Yes, that's what happened. There's probably no surprise there, right? It took me some time, but I finally got there. So when you're thinking about your quality improvement, think about these things. As you're talking to new people, try to craft your messages in such ways that really talk about what is the advantage? How is this compatible with what we're doing or trying to do? We're going to talk more about your messages in just a second. Let's go on to our next slide. And I'm going to turn it over to Jamie to just talk about effective communication more globally. Jamie, take it away.
Woo, thanks. All right, we can go to the next slide. Thanks, Amanda. Yeah, I'm obsessed with that diffusion of innovation. And I really also find Christina's comment in the chat very encouraging. So let's talk about effective communication, right? Doesn't matter. Yes, communication is king. Communication is key. So how do we do it, right? What works well and what sets us up to be less successful when it's done poorly? What happens? So communication is so important to cut through the noise. People seek clarity. I think that's human nature. And so cutting through that noise and being clear is such a valuable piece. When we don't cut through the noise, it creates misunderstanding. And misunderstanding is a serious threat, I think, in a lot of ways. Effective communication makes an impact. We heard yesterday in the data visualization, even ways to apply effective communication there, right? Making an impact through how you display your data, how you maybe address the mind and the heart with our QI projects and the story that they tell. When we don't communicate effectively, it can hurt people's feelings. And we're all human and we make mistakes. So, we've all found ourselves on that side where we maybe inadvertently cause hurt feelings. So let's protect against that. You want to ensure your message is not only received, but understood. And those are two separate things. So what can we do to ensure that the message is understood? We want to capture the attention of key stakeholders, right? And we want to build trust. Building trust is huge, whether it's with our colleagues and folks on our team or with the folks that we serve. There's so much mistrust in accessing care that I think we have to be extra vigilant in protecting and building trust. So again, if we're ineffective, that creates strained relationships, diminishes our value, and obviously would create unhappy consumers or patients, as well as, customers who are our colleagues in our work environment. Next slide. So how can we be more effective in our messaging? Here are a couple of questions you want to ask yourself. Is this clear and concise? I think it was Albert Einstein who said, if you can't explain it briefly, you don't know it well enough, right? So if Einstein can help us understand relativity and everything else, right, it really challenges me to make sure, how do I become more clear and concise to really have a grasp? Are our messages structured in a coherent and organized manner? From Lori DiLorenzo, one of my quality heroes, what do we want to accomplish? So before I talk to my supervisor, before I talk to my QI team, what do I want to accomplish? Because that helps me make sure that I'm coherent and I'm organized in my communication. Also, what's the word? What's the tone? What's the setting in order to communicate effectively? And then again, do we describe our goal and our purpose? What do I want to accomplish here? And how can I have that clarity? So those are a couple of tips. Let's go to the next slide. So who's your audience? Okay, I don't know if this takes you back to like high school public speaking or college or Toastmasters or something else, right? We say know your audience, but it's really, really easy in our jobs to honestly say, oh my gosh, I'm kind of bouncing from meeting to meeting, or you put a lot of work in crafting one presentation and one message, and it might really be awesome for one group, but it's not going to translate to another. So there's some real conflict and like a capacity challenge for, I think, us to really understand our audience and engage in that dialogue, engage in that agitation, evoking what they want as a goal related to what you're communicating versus just kind of saying like, I need to deliver an update and persuade you, to come into what I think is awesome about this or what I want from you. So of course your audience is definitely demographics, but also the psychographics, their needs and their wants. This is speaking to the agitation piece. What are your goals? What do you want out of this? As well as people's communication preferences, whether that be visual communication, interactive communication, etc. Next slide. So when we talk about demographics, all of us probably go to things like age, race, ethnicity, things like that, education level. But also one of my favorite demographics is time and position, tenure and position, because that makes a huge difference. You know, I think of Pamela Phillips here from Atlanta's DHE, and this girl has been rocking in this Ryan White world for a long time. So she brings so much wisdom and so much context, right? So I want to honor that part of her demographic in terms of her tenure. What's their role in the project, and then maybe the broader role in the organization. So keep these other aspects in mind. Next slide, please. Jamie, girl, what the heck do you mean by psychographics? Well, I'm talking about what are their aspirations, okay? What are their personality traits? What are folks' values, as well as their attitudes towards certain services or products? What are their beliefs? This is kind of tapping into their mental mode. What compels them? Great leaders can elicit this from folks, right? And whether you're working one-on-one with a patient or a team, if you have the ability to tap into an individual's psychographics and bring them forward and let that engage in this two-way street, you're going to be way, way more effective. And then again, of course, what's going to actually compel them to act? This is speaking again to that diffusion of innovation, sort of where are they coming for on that bell curve? And again, how do we promote eliciting what folks' goals are and not sort of putting our own onto others? Next slide, please. All right, so let's talk about this triangle. How do we tap into the why? Why is this important? What is the why? Knowing our why influences our what. When I can tap into all the different pieces that makes an individual who they are, knowing their why, knowing what compels them, and then being able to tie that to the why behind the project, the why behind we know this is successful, right? Connecting, ooh, we went on a roller coaster, connecting those two dots. I'll just wait a moment, look at the visual back. Perfect. So once, what would they like to see, but it's not essential? A lot of times it's valuable to let folks kind of emote and also get their wants out, but kind of have sort of like what's absolutely necessary, what would be nice, and then like what's a pie in the sky, because it allows everybody to contribute and get all of that, you know, out there and expressed. It also informs you as a leader, the QI, you know, being part of the QI team, or as someone who's communicating to an audience. And then it helps you also then sort of discern, again, what is essential. So that's your needs, that's a foundation. So what does this audience need from this work? What they cannot do, what is it that they cannot do without this work? Really hitting that fundamental level. Next slide. So let's also talk communication preferences, all right? How are we gonna go about it? What's our modality? We have all been forced into a virtual space given COVID, but we can make the most of it, right? So we've been sharing some different tools and tricks in terms of how do we utilize these different mediums? Again, what is a preference in terms of written or verbal? How do we maximize our visuals? How do we maximize something face-to-face versus virtual? Including the communication preferences, language, and tone, right? Honestly, you all might have noticed, sometimes I worry I border on informal too much, and that maybe compromises my message. So that's something I really do try to be mindful of. So of course, when I'm talking to my director of health, I'm going to carry myself a little bit differently than maybe when I'm working with my QI team, right? How direct, concise do I need to be? How do I maybe put it more meta or macro level, more of like an intellectual aspect, right? Because that's how my person across from me or my audience across from me is going to most successfully receive things. Or again, when is maybe a more conversational tone appropriate? So being effective and getting out of your comfort zone, right? So I'm more conversational and formal. So I have to challenge myself to be maybe more formal in certain settings, right? Demographics, we've covered those sort of in detail, but again, also thinking through that employment versus partner, gender considerations, cultural background, you know, we're really opportunity rich with the layers there in demographics. Next slide, please. So let's talk Who are our particular core audiences, especially as we think about wanting to share Impact Now work? Next slide. We have different lenses and different layers to this, right? We have community partners, staff partners, leadership partners, and of course, our HRSA project officers, right? Now, some of you may say, hey, you know what? In my role, I interact with community a whole lot, but I'm not really the one interacting with the HRSA PO. So take a moment to reflect again on where you know you're going to most often interact. And some of you might say, actually, I have some responsibility to interact with all 4 of these audiences. So we've broken each of them down. In community, we know we have things like community advisory board, patient advisory boards. We know we also have those partners who are maybe community partners within our organization, outside of our organization. You have the community at large, you have volunteers, and of course, folks of lived experiences who, again, might be staff, may not be staff. So let's talk about that, right? One thing I think we forget in QI work is how our colleagues are also our customers and also part of those who are being affected by change and involved in the change, right? So this could be your support staff. This could even be folks like the security who maybe aren't even associated with your employer, that's third party, but they're there, right? So of course we have providers like MAs, nurses, we maybe have dental providers, we have our medical case management or the layers within, as well as our IT friends and additional support staff, our housing case managers, our outreach people, etc. In terms of leadership, keep in mind there are formal and informal leaders, people, and sometimes those informal informal leaders really have a power lever that you want to be able to maximize. So these could be your informal leaders. These could be folks who are your managers, mid-managers, supervisors, obviously department heads or C-suite folks, right? And then even partner organization leadership. And of course, we have the folks who set us up for success as our funded partners, our HRSA project officers. So again, that could be directly related to your recipient dollars or cooperative agreement project officers. Next slide, please. So within each different audience type, right, there are various tips to communicate your message, right? We heard those kind of tip thought prompts before. Is this clear and concise? What do I want to accomplish? What's my purpose? So taking those in conjunction with what we see here can help create an effective message. So let's say I'm getting ready to go into a community advisory meeting, and I want to talk about Impact Now. I want to talk about what we've been doing for several months. How can I make sure I'm listening to understand and not respond? This is a skill. It's a practice. It's kind of like yoga. You're kind of constantly practicing it. You never like arrive perfectly, right? So how can I listen to understand and not respond? How do we, especially when dealing with community, not get defensive? Because that would be ineffective. That would be poor communication. It's going to result in those hurt feelings and in confusion and those side effects we saw. How can we be mindful of practicing our acronyms and being supportive and not, the acronym soup and leaving some people disconnected from our message because we're using jargon? Also, having that feedback mechanism, right? Historically, we've done so much taking from community groups. We want to hear from you. We want to get this from you. What's your idea? But then we don't follow through and kind of honor that level of engagement by providing information back to them, right? We don't want to just talk at them and we don't want to extract from them. We want this to be a partnership, right? Where they can see the impact of the information they share and the input they give. As we think of our various staff audiences, what's in it for them, right? That's another Lori DiLorenzo golden nugget, right? What's in it for me? How do you tie your QI project to their dailies? Again, tapping into their needs, tapping into their why, tapping into their what. Where is the clarity about what does this mean for your job expectation? And again, not just like the you have tos, but how this aligns with like what you want for yourself professionally, or how this aligns with the value and the reason you're in this work. So again, the why is very, very critical, I think, with staff audiences. as well as lifting up that patient impact, connect them to the heart of their work. And again, also sharing back with them, not just asking, how many times do staff feel like, well, I came to this meeting and we talked about this, but then I don't know what happened, right? Let's be really intentional and protect against that. As we think about translating our impact now, lessons learned, successes and challenges with leadership, you want to really think about this one too, right? Because oftentimes our leaders can be sometimes the hardest folks schedule-wise to have time with or get that attention. Also, as a leader, it's not their job to know all the details, right? So you want to be judicious in what you share with them and why. So again, what role do you want them to play? Do you want them to kind of cheerlead and amplify and recognize the work? Do you need them to kind of get their hands a little dirty and help you really implement change as like, this is standard practice now? So what do you want from them? And that might shift, several times throughout the course of your project or by whatever audience there may be involved with you in. So again, being specific, use them wisely and with discretion, prepare what you want in advance. You want to also know, again, do they want some visuals? Do they want a patient story? Are they going to care about the quantitative numbers, behind viral load suppression? 98 folks achieve viral load suppression, and that's the talking point that's really going to stick with them, right? So just be careful of what message is going to be most impactful for how you engage with them. Next slide, please. So fam, we're getting ready to go into some breakout groups so we can dive into this topic about effective communication and really use these very common audience groups that we know we'll interact with several times. So let's go to the next slide, which is going to give us some information about our breakout session. So we're going to have an hour here. But what that means is we have 2 cycles of breakout groups. So there's 2 different groups you can attend. We'll do the first breakout round for a half hour, right? Where we want folks to discuss successes and obstacles in communication. And it's going to be particular to a certain type of audience, right? We have community audiences, staff audiences, leadership, and of course, communicating with our HRSA project officers. So we'll do 1 30-minute breakout cycle session, and then you'll get to select again a second group. So I think Andrea mentioned at the top, if you have 3 or 4 folks from your organization on, also think about how you can divide and conquer. Martha Cameron, oh girl, thank you for dropping that in the chat. I did not talk about power dynamics, but that's absolutely present. And I think the power dynamics is a fabulous example of maybe something to discuss in these breakout groups and kind of unpack that, because there's a lot of different ways that can go. So first, I want to pause for a moment. Does anyone have questions about the breakout instructions and what to expect?
Jamie, if we don't have any questions, I'd like to introduce our special guest for our HRSA project officer group.
Absolutely. Let me just pause and ask Andrea, do we need to give folks any instructions? Don't select your breakout group yet, but do we need to prepare them for like how they would select that? And then I want to turn it over to Julia, if you don't mind.
Absolutely. I'm always happy to chime in. And again, I think I did it again today. I just tend to start talking and I don't introduce myself. It's quite rude. So I'm Andrea Mayer. I use she, her pronouns, and I'm the Senior Program Coordinator at CQII. I know not everyone knows me because I don't know everyone. I know some folks are new to the space, so welcome. Yeah, so for the, when you see the breakout groups pop up, these will be the names on the breakout groups. So if you want to engage more about how, your audience, your community audience, go into that group. If you want to focus on leadership, go into that group. And then we will be pulled back into the main room, and then you'll get a chance to select again. So you will not be automatically pulled in. You will have to select which one. I'm just going to say, if everyone goes into one room at the beginning, we're going to ask some folks to move to their other room and then to flip it, just so we have a sort of balanced number of people to engage in a conversation. So you will get your top 2 choices. It's just a matter of what order you go in. So I think those are the only things I can think of, unless someone has a question for me. If anything is unclear, please ask. If you have a question, someone else probably does too. They're just not brave enough to unmute. So any questions?
Thanks, Andrea. I didn't mean to delay our special introduction. I just wanted to, we had a couple of tech issues yesterday, so I just wanted to make sure we're minding our P's and Q's. But Julia Schluter, who do we have with us today?
Thanks, Jamie. And clarity is our friend. So Andrea and Jamie, thank you. I also want to introduce myself. My name is Julia Schluter, and I use she, her pronouns. I have the lovely opportunity to be a coach for this collaborative and coach some of you all here today. So thanks for being here. I'm so excited. So for the HRSA PO breakout room, we have two wonderful members from HRSA's HIV/AIDS Bureau. We have our CQII project officer, Chris Redwood. And then we also have, I think, just gonna say, the most amazing project officer ever. Her name is Sambo Pujay, and she was my project officer for my C&D grant. She has since moved on, but Dr. Sambo Pujay is a senior public health analyst with the community of HIV/AIDS programs with the HIV/AIDS Bureau. And in her new role, she supports the central branch's project officers around effective recipient monitoring, technical assistance, and quality control reviews. Before she was at HRSA, she's been in our shoes, okay? She understands, trying to create programming for STD and HIV prevention. She's done a lot of work with youth for outreach and community building and developing plans for coordinating health education in the DC area. And she's also worked internationally in Uganda and Haiti as a consultant for developing culturally appropriate HIV/AIDS research and programming. So she is a huge proponent of quality improvement. Every time we met with Dr. Sambo, she would always ask about participation in CQI activities, collaboratives. And so it'll be a real treat to have her in that HRSA project officer breakout room along with Chris. Thank you.
All right, awesome sauce, y'all. We are very, very lucky and very, very fortunate. We've done a handful of these collabs, and it really is very precious to have the level of engagement with our HRSA POs that we've had with Impact Now. So folks should begin to see the various 4 breakout audience types. Again, we'll have 30 minutes. So it's 12:45 Eastern. We'll go to 1:15 Eastern time. You'll come back to the main Zoom room. Following that second 30-minute breakout room, we'll go on a break. So stay tuned for more info, but we're looking forward to diving into some successes and challenges with these different audience types. Select the breakout room of your choice, and we'll see you all soon.
Icebreakers, before we start talking about things like viral load suppression and CD4 counts.
That makes a lot of sense. Anything else?
There was so much stuff. Like there was literally so much stuff. It's hard to cover it, and I know that we're short for time, but I think what David, what I really want to underline is just how important it is to show up with respect and to establish rapport first and a connection, and how important that is. So how you show up, and then what, when, and how you ask are all really important, and speak to people.
Yeah. I'm walking away with, and I think this encapsulates everything that David and Christina just said. Someone shared about asking, how is your water? And they related it to 2 fish swimming in the same water, but just not understanding how the water is for the other person. And I thought, wow, because it really talks to just making sure you know what water the person or your audience is swimming in before you share what you have to share. I think that was so brilliant, especially as it relates to community. So yeah, ditto to everything, and just know how the other person's water is.
Thanks so much, Martha. How about Melissa, Jane, or Kamisha for staff? Quick highlights.
Took a bunch of notes. Again, I echo what everyone else is saying. A lot of great, strong conversation when it comes to staff communication. A couple things we're talking about buy-in in regards to, especially when it comes to QI work. getting buy-in from staff, how to get buy-in from staff, asking the question like, what is your dream process, or what is your least favorite part of the process, to kind of gauge information. Recognizing staff, just the importance of the recognition, and evaluate capacity. And then we talked about self-care, the importance of, managers and leaders to provide self-care to themselves, right? Because it dwindles down. And then there was conversation about when it comes to QI activities, bringing some gamification, making it fun, so that people that aren't necessarily involved in QI work can feel excited about the work that's being done. Finding natural leaders, that was another one, right? So that you can ensure there's some influencers and some QI champions and things like that within the work. And then know what your goals are, right, from the beginning. And then finally, another thing we talked about was empowerment, right? Empowering, and especially when it comes to Impact Now work, that this is a national, right, collaborative, right, where the work that we're doing is beyond just our clinics, beyond just the work that we do day to day, but we're moving the marker forward to not affect just our own patients, but patients to come as well.
Great. Thanks so much, Melissa. Kathleen, do you have a highlight or two from the leadership group?
I do. We started out, actually, Vivian helped us start out by thinking about two kinds of leaders. There's the informal leaders who we call influencers, and we also mentioned, Jamie mentioned that in her intro. And then the kind of the formal leaders, or the positional leaders, the hierarchical leaders. So we thought about kind of both of those groups and how it was important to engage them. And we talked about, we had lots of participation from lots of great folks. So it's also hard to summarize for us, but we talked about what happens if you're getting silence from your hierarchical leaders. So how do you engage them? What are the opportunities you have in regular meetings to build a QI update into that? And then also just to continue to push communication their way. We talked about the necessity to be brief and to use our elevator speeches and headlines because they always are aware of their time in a certain way. We talked about the need to be clear about what it is that's happening, to be transparent, that there be no surprises for those leaders. And we talked about being clear about what the ask is. That if we leave them an essay question instead of multiple choice, then that's much harder to respond to. And then we finally brought it back. Clemens actually had a quote from someone he had heard recently that I suspect everybody took away, which is at the end of the day, in terms of all of this different communication, if in doubt, be human.
Oof, that's a great quote. I like that a lot. And last but certainly not least, Chris, any highlights you'd like to share with us? I can't see you, but I'm hoping that you're here.
I am here.
Great.
Well, yeah, there was a lot. There were a lot of there weren't specific questions, I would say, to the collaborative itself. It was more of, these are some of the challenges we had in engaging, or these are some of the we're seeking advisement on how to truly engage our POs better. I mean, but some of the highlights of what we shared, what communication is incredibly important. The monitoring calls that are held by the POs don't leave a lot of room for CQM discussions, and oftentimes those conversations are centered on redundant regurgitation of information that has already been, so it's come to the table as a recipient or the subrecipient organization to say, hey, look, PO and HRSA, these are the specific items that we want to share with you about our QI work, particularly in this collaborative, as opposed to, let's check the boxes. There are specific matters with respect. Neil brought up his hurdle of being N of one, managing multiple agencies, and not knowing how to navigate the conversation between the subrecipient organizations and the Part A's, or the recipient organizations. And the challenge being that a Part A, whatever Part A it might be, they direct CQM very, very differently to their subs. And just emphasizing the point that this is a collaboration. It's not, hey, Part A, I'm telling you, the subrecipient, what you need to do. It's identifying, working with the subrecipient so the subrecipient understands, look, quality improvement is a part of all of our work. You know your local epidemiology better than we do. We want you to focus on viral load suppression. You might want to focus on something else. Let's have a conversation about that, understanding what your capacity is, not only your resources or the lack thereof, but also, what is your QI acumen? And there were a lot of other things that we discussed. I think Sambo, we also had Alonda on the call. She's a PO in DCHAP as well. They were both able to provide the perspective of, this is what the PO faces. We got a 30-minute monitoring call. It's not enough time. Oftentimes, the administrative and financial matters that are that take the center stage. But you, as the recipient, reach out to us. Send us an email in advance. You help us set the agenda for those monitoring calls, so that we really truly discuss the things that really matter with respect to CQM. And there was one other thing that I wanted to say. It was see, this is what happens when you get old. I forgot the last thing that I want to say, but I think Andrea also took some notes. So if she wanted to chime in, she certainly could. And I just want to let all of the participants know, once again, this is the first collaborative out of 9 that we've ever involved the POs. So this is, we're going to go through some growing pains here. And as you already know, the PO turnover is relatively high in the Bureau. And not a lot of the POs, actually, I gotta say, the significant majority of our POs don't have a clinical or a CQM background. So ask the difficult questions if you have concerns around your CQM program. What they should be doing is reaching out to our branch, my branch, for guidance and support, and maybe we could jump on a call. That communication piece, I can't overemphasize though.
Perfect. Thanks so much, Chris. Well, thanks everybody for participating in a conversation about communication. I will tell you, it is much more important than we give it credit. Often, if you're running into a lot of obstacles, sometimes it's how you're saying it, not what you're saying. So now I'm going to turn it over to Kathleen and Jane so that they can talk a little bit about sustainability and what that means for our work. Kathleen, take it away.
All right. Thanks, Amanda. So Jane and I are going to be talking here about sustainability. I'm going to talk through the slides, and Jane's going to be doing some storytelling and also pulling things out of the chat. And she may be asking some of you to unmute at some point to talk about what you wrote into the chat. So next slide, please. So I really got interested in sustainability after I put my heart and soul into making some changes that really worked at my hospital system. That actually had to do with having a core of people with lived experience who were both serving patients, but also training a pipeline of new folks. And that program got stopped by the hospital when there was a few bad budget years in a row and lots of slashing. And after I felt like my heart fell out onto the floor, I got really interested in what does it take to really sustain programs and improvements that you've made, and how to think about that. So we're going to actually talk about, ways to think about how to sustain the improvements that you're making. It may seem too soon. Sometimes we don't end up starting to talk about this until really late in the day, but it's not too soon. And actually, you can start thinking about sustainability from the very get-go. So during testing, during an implementation, and then after implementation. Right now, some of you are in testing and some of you are in implementation. Those of you who are in the adapt and adopt groups are kind of starting to move toward implementation. So you're really in slightly different places on this timeline. So next one, our agenda, our objective for this is really just to be able to talk about different ways for you to think about and be able to state different ways to sustain gains that you make across your improvement as you identify what works and see that it's working. And then ultimately, you would be able to actually write a plan that would help you to sustain those gains. You may not decide to do that, but you would have the ability to. Next one. So over this continuum, the way we think about this typically is you do the improvement, which you've been focused on now. We've been focused on through the months of this collaborative. Then you want to figure out how to sustain the improvements that you make in the in the smaller circle that you've been working in. And then you're actually going to look outwards towards spread. Many of you work in systems where there are multiple sites. So you're really actually thinking about sustainability across all of those different segments. Next one. Because you actually can't do them in sequence, but need to think about them all at one time, it really kind of looks more like this in your head, and you're overlapping your thoughts about how each one of these works. Next one. So it means sustainability means not just how do we lock down what we're doing right now, but also how do we protect what we're doing right now, make sure that that we don't have to go back and reinvent it over and over again, but continue to move forward, bring in new partners so that we can co-evolve, change, and shape what it is that we've been doing together. And how do we progress? How do we improve on our improvements? All of these things actually are also part of what sustainment means. It does not mean static. It's an active process. Next one. So, but at the moment, what it means is how do we hang on to what we have gained and make sure that we don't fall backwards and lose what it is that we have gained. Next one. There are, you will be doing these PDSAs. Right now, you're focused on this, your staff, in some cases, your leadership. And what we hope is that upper line is what happens, and that you sustain those gains and even improve over time. But we all know that there's also that risk of the lower line happening, and that as a collaborative ends, that if things have not been really locked down, that you'll see that you lose those gains. We don't want that to happen. The entropy process, we want to really make sure that we're protecting the gains and looking up and forward. Next one. So this is actually a thought experiment for you, but I'm going to ask Jane to be the one who talks this through. Thinking of a change that was initially successful, but ultimately went away. Thinking about why did that happen, for us to then use that as kind of material for talking through what to think about for sustaining. So go ahead, Jane.
So I just want you to know before I start that you may have noticed through this collaborative, when they want to talk about something that didn't go well or didn't go right, they come to Jane. Okay, and I'm really proud to have that honor, because as though I've made a lot of mistakes, I have learned a lot from every one of them. So I'm going to tell you a story about an unsustained success. Okay. A decade more ago, I was the project director for Ryan White Part D statewide network. We had 7 large agencies that covered the entire state of New Jersey with Part D services. Our PAP rate was abysmal. And we had tried a lot of things through the years. We had done focus groups to find out the whys. We did coordinated appointments. We did travel to the GYN office. We did childcare at the GYN office, coloring books and crayons included. We did PAP festivals. We did 2 PAP festivals a year. And everything we tried got us somewhere. But it wasn't anything that we could spread and make it like it was the new way we do business. So long time ago, I'm sitting in a learning session, a CQII, I almost said NQC, a learning collaborative in-person session, just as you are sitting here today, but it was in person. And it was 5 states that had come together, and we each had 15 or 16 people on our team, so it's a little different. And I'm sitting at night there having a glass of wine, and one of my team members comes up to me, and his role on my team was to be the liaison between my team and the AETC. Thank heaven for the AETC in New Jersey. And he said to me, Jane, I can fix your PAP problem. I said, boyfriend, I'm all ears, spell them. And he said, I can send my trainer into your hospital office to stand next to your nurse practitioner or nurse and do hands-on training for PAPs with your patient. He said, we will test them, get them certified, and then you can do the PAP right there in the HIV visit. I said, wow. One of the things we heard about in the focus group was that the women did not want to tell their personal HIV story again to another provider they were going to see once a year or every other year. They didn't want to go to another appointment. Barriers down, right? So I said, okay, let's talk about this some more. So we go through the training. The nurses are ecstatic, okay? They have a new skill. They feel valued. They feel empowered. Unfortunately, they also feel marketable, right? So they've got this new thing they can share. So now, when you go into the exam room, you know how the nurse takes your chart and she hangs it up and she says, the doctor will be with you shortly, right? That doesn't happen anymore. The nurse now says, ooh, in your chart, I see you're due for a PAP. Let's get that done today. The excitement that the nurse feels for her new role, that's contagious, right? And it wraps around that patient like a big hug, and they are receptive and they do it. So, you know, we get that mobile PAP cart now that we have, we pull it into the room and it starts to happen. So I'm sitting back and I'm watching these numbers go, and 3 PAPs this week. Wow, that's more than we did last year, you know? And it starts to get better. And I'm thinking, wow, we are actually going to reach our goal. And then I'm thinking, wow, we might have to raise that bar. This is amazing. So I'm watching the numbers climb, and someone taps me on the shoulder and says, Jane, you said you were going to work on that adolescent dental project. I said, oh yeah, dentist, be right there. Hold on. I turn to the PAP ladies and I say, love you. You're awesome. Keep doing it. It's great. I'll be right back. I go back to the dental folks and I say, okay, we have the team, we have the provider, we have the insurance set up, we have the after school hours, go. I come back and Kathleen, I was gone 5 minutes. I'm telling you, I was gone 5 minutes. Or maybe it was a month. I don't know, maybe it was a month. And I find out that that PAP data had tied itself to a brand new sled and perched on top of an icy steep hill and went whoosh. And it took my breath away. I thought, oh my goodness, what happened? And then I thought, oh no, don't worry about it. CQII taught us something about, you know, common cause, or no, this must be a special cause variation and then it's all going to go away and come back. Yeah, no, it didn't. So I round up the girls and I say, okay, you know, what's happening? And it was a little quiet at first. And then it got explained that although everybody was excited about this and enthusiastic and supportive of this project, the HIV providers did not want that abnormal PAP result in their chart, because then they were responsible to follow up. They didn't want to follow up on that colposcopy and send that woman out. They didn't want to follow up on whatever else that woman needed. Not in their wheelhouse, didn't want to do it, and it crashed. Okay, so in one of my sites that also had a large GYN clinic, they were able to adopt one of my nurses for a few hours or whatever time and put her underneath the supervision of one of the GYN docs there, and she could still do the PAP during the visit. But then at the end of the day, she had to go down to the GYN lab because that's how it was set up, and go into their database and type all her activities in there. So that was okay for her, but it didn't work at any of the 6 of my other 7 sites. So this glorious project that took off so beautifully just was unsustained. There was just not enough forethought on, I guess, I don't want to put it on the HIV providers, but we didn't think of that ramification of having that result in a chart where it didn't belong. So, Kathleen, that's my story of unsustained success.
Yeah. Thank you, Jane. I think we all share your pain, and probably many of us have had similar experiences. And we will come back to actually many elements of that story. Next one. So we're going to think about just some very high level categories, and you can think about Jane's story as we go, in terms of things to think about why things don't end up being sustained. So the first one is leadership considerations. There's a lot in each of these categories. We're just going to talk about a couple of them. One of them is the flavor of the month problem. I think you heard that in Jane's story in terms of her requirement to actually focus. She had to change her focus for a period of time. No, the written policies not being changed and written job descriptions not being changed. Those are all things that actually we heard sort of echoes of in what Jane was talking about. The bureaucrats are your friends on this. We really need their help to make these the changes actually become part of normal business. Next one. The next category is kind of says human factors. A lot of this actually affects staff who are required to make these changes. And I know you're all dealing with the challenge of fatigue and just everything we've been through in the past few years together in terms of the pandemic and the staff difficulties after that. I know you all have that in front of you, and all of that leads to competing demands and the need to think about what is the priority this month in order for us to move forward and survive. That's another major set of reasons why sustainability doesn't happen. Next one. Then there are things that have to do with what did we design? And are we trying to sustain something too early before we really know all the failure points, before we know, hey, is this actually going to work in the other site? Is it perfect for here, but not actually something that can be implemented in other places? So that's lack of standardization, which is it the same even in our site, but then also lack of a process that can be described and implemented across multiple areas. I think a lot of us right now are also dealing with the supply considerations. We keep running out in my hospital of some of the materials that we need for the special kind of PAPs that we are trying to get better at doing now. Different kind of pap smear. Next one. So there's kind of this is kind of a more generalized list here of thinking about all those different buckets: the leadership bucket, the human factors bucket, and then the environmental factors. Any one of can show up as any one of these things. And I think ultimately one of the ones that I really focus on, and that's part of our job as encouraging and managing change, is that the changes aren't seen as irreversible from the beginning. People can have a tendency to think of it as, oh, this is an experiment that we're going to do, and then the experiment is going to be over, and we're going to go back to normal life. Can I have an amen for, does that happen in your organization around CQI? And a lot of that has to do with lack of recognizing and rewarding people who have made those changes, stepped out, done extra work to make that happen. And then also the either lack of measurement or lack of making sure that people know about the measurement, making sure that the changes that you're making are actually seen and measured by the whole organization. Next one. So let's look at the flip side then. How can we plan and actually plan for addressing these things in advance and for our changes that we work so hard on to be sustained? And really here, there are just these two main points. There's detail under the points, but the two main things are really just to be clear on what's being sustained and who owns it. And then thinking about and building in sustainability factors through all phases of your testing during implementation, and then thinking about it as into your implementation phase. So those are a couple things we're going to focus on for the next few minutes. Next one. So in terms of the what we're sustaining, I think you probably know the most about that in terms of what is the change that you're trying to put in place. And the thing that I want you to remember about that, though, is that it's not just the change. You're not going to fight for the change to stay in place. It's because the change had an outcome, that it resulted in something good happening. As an example, a lot of you are implementing case management, different kinds of case management protocols. And those are great, and you want to be able to protect that and figure out how to make that normal life going forward. New outreach protocols, for instance, new things that the case managers are doing. But really, the thing that you want to remember is you're doing that because it resulted in an outcome that you were able to demonstrate worked to address, in this case, the problem of people with unsuppressed viral load. Next one. So what about the ownership part? You know, the problem that if it's everybody's job to do something, it's nobody's job, and it becomes really hard. You know, real sustainability requires that there be people whose job it is to do that. And we need to give the process and the work the respect to say that it needs to be part of somebody's job description, really needs to have an owner. Whose job it is to make sure that that we don't forget about this change, that when staff member A leaves, it doesn't leave with them. So it means the person who is responsible for continuing to shape the process until it's, you know, until your whatever new thing you're doing really works. Continuing to measure, and then making sure that the changes that you've made actually get memorialized in the pieces of paper, the processes, the job descriptions, the different things that actually are how we make things work in the workplace. Next one. So you want to build in sustainability then during all phases of your CQI work. So right now you're doing testing. You want to be thinking as you're doing some of that testing about how will we continue to do this on a scale that involves not just today, but but all 5 days of the week that we're open. That not just in the spring, but also in the summer and even in the winter. What's it going to look like? So thinking about sustainability while you're designing and doing your testing. Next one. During implementation, you all are moving into implementation, which means you believe in your change, you've tested your change, you know it's working, you've seen that it's working, and you're going to actually now be making it normal life. So the change management concepts that Amanda talked about this morning, and then you want to design a process that actually is not kind of hit and miss, everybody does it a little different, but that's standardized, that where you've thought through what could go wrong with your process and kind of try to error proof it some. We'll talk a little bit more about that. And then if it goes wrong, why did it go wrong on this given day or in this given site? And how do we predicting the places where it might go wrong so that we can respond to them quickly. Next one. So let's dive a little bit deeper into each one of those things. So in terms of standardization, so what that means is that you are thinking about not just, let's say you have a different process as you're checking people in, to do a different kind of screening about what their challenges might be with adherence or with sustained viral suppression. So the front desk clerks are going to do something different in terms of who's in front of them. When you standardize, you want to make sure that across, every day and who backs that person up if they're sick, and do you have the same materials, the same checklists, that everybody is trained to those, so that they know we're now all using this different. That now we're using the pink form instead of the blue form, and we're getting rid of all the blue forms, so that we know we're working on the pink form now. And then you actually show up the owner of the process shows up to make sure that people are doing the new process and to encourage them. And then to actually, if people are falling back and you're starting to see the blue form creep in again, that you're actually giving people feedback on, hey, I see you're using the blue form again. Why is that happening? And let's think about how can we fix whatever is that's causing you to fall back to the old process. It is hard work to do this. Implementation is hard work. It requires the day-to-day. The testing is a little bit like being a midwife, and implementation is like being a mother. It's, you know, the day-to-day, sometimes unglamorous work of really helping sustain and grow what's happening there. Okay, next one. So the question that you can ask yourself or the people who are doing this work, in this case, let's say all of the clerks, you can get them together and ask, how are you doing this new process? Just walk me through it. And then when you actually ask them, it's, as opposed to what you think is happening, what is actually happening, then you may very well find out that you have 5 different processes happening if you have 5 different staff members. This has happened to me. Jane may be our go-to girl for describing when things don't go well. We have all made all of these mistakes and have had all of these experiences. It's a great teacher. So yes, so I have definitely had this, and I could say as a young manager that my tendency was to say, okay, it's all good. You know, we live in California, it's fine, do it your way. And then what you realize down the line is that that is really a mistake. It is, it may feel good to you as a manager in the moment, but it will lead to a process that is messy and difficult to sustain and will make it a lot harder. Much more likely that your hard work will actually disappear because you haven't taken that next step of really locking it down. Next one. I'm going to talk through this slide, then let's stop, Jane, and start picking up some of the things that you've noticed in the chat. Okay. I was
Yes,
just
we have, well, first of all, everybody loves you. And we just have one question from Julia. What is your advice for folks that aren't interested in standardization?
So I think I would say, and you, Jane, you should fill in also, that I don't think anybody is interested in standardization. People all want to do it their way. You know, so one is pointing out to them, you know, what a previous process where nobody got where it didn't get standardized. And then I think you figure out what are the key elements that have to be standardized and where can there be a little bit of, you know, a little bit of individualization. It's a judgment call sometimes. What about you, Jane? What would you say to that?
I think it's understanding the why. The why do we have to do it that way? Why is that important? And I think if you can share that why, and if you have a good one, if you don't have a good why, then it's a problem. But understanding the why is helpful when you start to change something like that.
Yeah. That's a much better answer than mine, actually. And yeah, just so that's so important all the way across all of this work, actually, is to do your team members, give them the respect of explaining why it is.
Amanda, Amanda has her hand up.
It's also going to say that if you don't have something standardized and everybody's doing their own thing, it just creates chaos. And, you know, and it's like, you know, you have to have some parameters and structures around what you're doing. Yes, they need to understand the why and where you're coming from that. So there's buy-in. But I feel like if you give too much liberty just to do your own thing, then it creates nothing but confusion and then nothing gets done.
Mm-hmm.
Very wise, Amanda.
That in itself, to me, as a manager, I would just like feel more anxiety about things being done their own way without any standardization.
Yep, appreciate that. Thank you, Amanda. Jamie, you have your hand up.
Yeah, I think Christina just dropped an incredible comment into the chat, how standardization really takes the cognitive load out of things. And I think that's a wonderful way to frame it. for me, when it comes to resistance to standardization, I have found an effective communication tool to be something such as what we don't want to happen is, and that might be what we don't want to happen is your good work to fade away. What we don't want to happen is you're wasting your brain energy. And so you tap into the why, but what we don't want to happen blank is concise and quick, and can also help folks receive standardization better.
Any other thoughts before I turn it back to Kathleen?
I think for me, standardization is important, especially with anything that has an effect or an impact on patient or client care. Because when a patient walks into your clinic, they should know what to expect. Like if I walk into Starbucks and order a latte, I should get a latte. And if this other Starbucks decides to do it like a completely different way, then they've not given me what I've ordered. I expect a Starbucks latte to be a Starbucks latte. If I walk into the coffee shop on the corner, that a latte might be a different thing. They might put cinnamon on top, and Starbucks never does. I have to ask for that. So for folks to kind of, I don't say to standardize the patient experience, but to help build trust with patients and clients, that when they walk in the door, they kind of know what to expect. Because a latte is a latte when you're at Starbucks, right? You're not gonna get a Dunkin' iced coffee when you walk into Starbucks.
I do like that, and that does build trust.
It builds trust. It's like, this is not what I ordered. It is what you ordered. That's how we do it here.
And I'm glad I don't get a Dunkin's iced latte when I go into Starbucks.
Right. If you want a Dunkin' iced latte, you'd go to Dunkin'.
Angela, I talk about this topic a lot, and I don't think I've ever quite heard anybody articulate it that way, but you are so right. Is that especially because people are nervous when they come to the doctor. They are nervous. And especially when you're nervous, you want to know what to expect. And that and so that it is respectful to our consumers that we're serving also. So thank you for that. Thanks for contributing that. Jane, anybody else? Should I go ahead?
I think you can go forward.
Okay. Next one. So here's where, by the way, I find that in the error proofing area is an area where the laggards or the slow adopters, they are the folks, oftentimes their objection to moving forward quickly has to do with things that they're afraid are going to go wrong. So they can really be helpful for you to think ahead. What could go wrong here? So as you're thinking about how to error-proof your processes, you can, these different kinds of reminders are important. With not using all of them, but maybe using more than one, because people just learn and are stimulated by different things. People who may not respond to an alarm will be able to retain or use a schedule next to their desk. Then differentiation, making it really easy, like it's the pink form now, not the blue form, is a lot easier than it's form 72J instead of form 72, whatever H. And then figure out, as we were talking about a few minutes ago, where you really need people to do it exactly the same way, and where you can give affordances is basically a little bit of wiggle room, a little bit of people bringing their own flavor. And you need to be very judicious about that in terms of when you can do that without endangering the process. Next one. So then, well, what if one of the things you've been wanting to predict it, but you haven't been successful, and a failure happens? Well, optimally, you're looking ahead as it says here, what could go wrong, but if it has happened, then what went wrong? Really understanding and doing a root cause analysis. People who worked in hospitals under the joint will be familiar with that. Root cause analysis, and just kind of thinking through making sure that you respond to any failure with actually thinking through how do we prevent it from happening in the future. And then contingency planning. What are things that we can expect might happen, like people might get sick, like the power might go out, which happened at my house an hour ago. And like those kinds of the things that you can actually predict. Next one. So that was during implementation. All that was during implementation. Now we're thinking about after implementation. So what this means is you're not necessarily at steady state. What it means is you thought up your change. You tested your change. You verified that it was a good change, and you changed your change until it really would work for you. So you've implemented it in your site now, and now you're really looking at how do we make it, how do we spread it, and how do we embed it? How do we make it normal life from now on? This, by the way, I moved from my hospital to the county because, man, at the county, they know bureaucracy. I now identify as a bureaucrat. And the thing about it is there'll be a county of Alameda, 100 years from now, still operating. And so it's really hard to get things through civil service, to get things, codified in budgets. It's really hard to make that happen, but once it happens, it will be there forever. You'd have to dig that change out with a backhoe to get rid of it. So that's what in this phase of my career, I'm learning that. So sustainability after implementation, and these are the factors to kind of think about. Who do you need to communicate with? Documentation is really important, even though it's not fun for most people. Measurement is important, and continuing to measure is really important. That doesn't go away, and its value doesn't go away once we have identified a change that we want to do. So education and training, how do you make sure it's in front of people and they get reminded about it? Making sure leadership knows why we're doing that, why this change is in place and supports it. And culture, what are the things you do that make sure that something that help a thing go from the new way we're doing things to this is how we do things here, so that people actually feel ownership over the change that has happened, that they understand why it happened, they went through the wars to get to that change, and that there is support for it. It's not just the thing that Kathleen said we have to do now. Next one. So let's talk a little bit about each of those just briefly. So communication, a lot of it has to do with the reasons why. Success is always more popular than the mistakes we made along the way, but those can be useful too. And then it's really important to document those benefits. And as we talked about, we'll talk some more about communication, but as we talked about in our previous sections, making sure that you're getting the information about what's working in front of people repeatedly helps and will prevent people from having that impulse to kind of slide back into the old way. Next one. And by the way, measurement and stories. Measurement and stories are both important. Narrative and numbers are both important. They speak to different things. They speak to different people, and they really both need to be there. So documentation.
Jamie, Jamie, did you want to contribute something at this point about measurement?
No, I just put it in the chat. I'll take that there. But I do want to say one thing that Kathleen said earlier that's really also stuck with me related to, and this can be documentation. I really like how you said, respect the work by seeing through changes to job descriptions, because as a former, supervisor, like when you say change the job description, my breath gets taken away a little bit. And I did work at a municipal entity. So then I'm like, oh, mother may I, that can take so much time and effort. But the way you presented it as, changing those job descriptions and tackling however annoying that process may sometimes be is a way to respect the work. And I really loved that reframing. And if people have comments about the measurement thing in the chat, you can always, connect with me as well. But thanks for sharing, Kathleen.
Thanks, Jamie. So job descriptions, think about how people are oriented as they're coming in, because new people don't have an old way to fall back on. So they're your allies. They're like, I thought this was how we do it. They will help you embed the new thing. Policies and procedures, flow charts, all of these things are different ways that you can embed the change, and they are worthwhile doing. They are worthwhile doing. They are a part of this work to make sure that we don't fall backwards. Next one. Measurement, there's a lot of, we've talked a lot about measurement here, and we are all, I think all our CQI coaches are big measurement enthusiasts, because we've seen how powerful it is. So don't stop measuring and don't stop communicating your data. And in terms of the ownership, that's really for the owner of this process of, of this implementation, having those data is really, really key for them to be able to do the communication they need to do at all kinds of levels. And then, as it says in the bottom bullet, if you in order to avoid falling backwards, you want to make sure that you've got some kind of threshold to revisit, which just means, data kind of vary for lots of different reasons. But so what's the point at which the alarm bells will go off and cause you to revisit the change and see, are we still has the situation changed, or have we stopped doing what we thought, the change that we tested? Next one. Education and training. Again, it's a matter of respect for your workers, to make sure that they have the opportunity and the time to actually incorporate this and to really understand the why and the how. The cross-training is a really important one. I want to pick that bullet out of this list for you, because you will have people go out sick, you will have people leave. So part of what makes it sustainable is predicting that there will be turnover. There will be. That's how our lives are right now. So cross-training, really important in terms of people being able to understand at least some of how how people in the other roles are doing their work. Next one. And then leadership. The job of leadership is kind of to do these things, to remove things that are in the way of a sustainable change, to make sure that the owner knows that it's their job to continue to be the engine for sustaining that change, and then to maintain that change even as the environment changes around them. So if you are a leader, this is part of our job as leaders. And if you're managing up and helping a leader do their job, then these are the things you really should be able to expect from your leader. In particular, that fourth bullet, because the flavor of the month problem is just really, really, really challenging for sustaining your change. Next one. So this is the last slide. So we have a few minutes here where we can talk, but just to remind you about as we went through all of that you want to be clear on what it is you're sustaining. That's kind of your headline game, your elevator speech, being able to describe, we made this change in order to improve this factor so that we would get better viral suppression and our patients would be healthier. Then who owns it? And then thinking about sustainability, not just at the end, but during your testing. Is this going to be sustainable? During implementation, is it doable across all seasons, all shifts, and predictable disasters? And then after implementation, making friends with your bureaucrats, getting those guys in HR on your side, and really doing the work of building it in to the structures of your organization. So I'm going to stop there, turn it back over to you, Jane, see if something has popped up in the chat.
Well, I'm trying to watch the hands and I can see about 50% at a time, and I don't see any. There are some comments from the faculty. Julia, if you have something you want to share.
Yeah, I was Kathleen's remarks about, making sure that you're providing training. Kathleen always said, we have the Noah's Ark rule, train two. I even call that the Kathleen Clannon rule when I train people. But I think one thing that has led to greater sustainability success within my own QI work is I used to be the one to like train the people, right? I'd be like, I'm the quality manager, I'm in charge of the project, I'll train you. And so many times when I did that, the process wasn't sustained. And so it was, if I could ask the person who tested the change, who was part of my QI team, or their program lead, so a leader within their organization, someone who is their supervisor, is training them on how to do that process, that has led to much greater sustainability and the efforts continuing forward than just me, myself as like, it's like, oh, Julia's asking me to do it. Well, no, this is, we're the business as usual. We're moving into that. And so that's one thing I've really tried to incorporate in my own sustainability processes.
Awesome. Do we have any other questions for Dr. Clannon before we move on, or any other thoughts about sustainability that you have from your own experiences that you want to share in the next couple minutes?
I have mixed feelings about what I'm about to say, so just take this with the caveat. I like to give people a little bit of an off-ramp to change as well. So if we've rolled out this process and this is now the standard process, if they feel like they need to deviate from the standard process, I give them like a direction to point that, like, come to me or go to this person if you have a situation where you feel like this standard process is not going to cut it. Because otherwise they just kind of create their own little side processes to like sneak around the roadblocks. But if they'll come, kind of use the off-ramp and kind of pull over and say, hey, this situation is non-standardized, the standardized process isn't going to work. That allows like whoever, like the medical director or myself or whomever, to say, okay, in this particular situation, we can go non-standard because this is just something that we've not seen before. Or this is the third time this has kind of come up. We might need to tweak the process to make sure that we kind of build this in for when these things happen. So I don't like to use the off-ramp too often, but I do like to kind of give people an avenue that if they need to go non-standard, that's like built in.
Awesome. Awesome, Angela. I like that off-ramp. Might use it. Good. Anything else? Or Kathleen, anything else you want to share?
Jean has her hand up.
Oh, okay. Jean. Jean from New Jersey? Yes? No?
Oh, you know what? That was my cursor. Sorry. My cursor's in the shape of a hand. It was hovering over you, Jean. Sorry. Sorry. So then that's it. In the last minute, I just want to, I like Amanda, I really love the change management work that Rogers did. And I think if he, were around to redo it, that business of calling the people who are at one end laggards, I have a reaction to that. The people in our workplace who are doing this work every day, and they are working hard, who they know in their gut how hard it's going to be for them to add on change on top of barely managing what they're doing every day. And I think we can't see them as our enemy, and we can't see them as broken. There's nothing wrong with them. There are people who have a view of the work and the process that, that we need to be listening to. So I just, I want to really lift them up, and in the process of sustainability is where they shine. If we can convince them that this change actually did work, it wasn't as bad as they thought, that it really did, did result in improvement, they will be the people who will help us error-proof it, who will know that we have to use different colored forms, whatever it is, they'll be the ones who will know. And so I wish we could retrospectively get Rogers to change that and call them the historians instead of the laggards. They are important. They're really important.
What I love that the book pulls out is that we're all laggards in something. Like, or historians in something. There's something about our lives that we're not moving on, we're not letting go of. So I thought that was really like, you could be an innovator in some places and a lagger in other places. So you are not just one end all be all. But that's a great point. I know we're late for break, so I'm going to stop talking.
That's it. Thanks, everybody.
Great, thanks for that. But Jamie had her hand up, so-
Chandrea,
Yeah.
Chandrea, back to you.
Thanks. I know Jamie had her hand up though, so I feel like Jamie, do you have a quick comment you want to add?
Yeah, so we've talked about sustainability in several collaboratives in several ways, and I just want to really say thank you to Kathleen and Jane for bringing this at a whole other level, and really some fresh information with really specific and concrete ways of approaching it beyond like people, process, and policies. This really hit a whole new level for me, and I'm hopeful that that was the same for others. So thank you both.
Thanks, Jamie. And yes, echoing Jamie's appreciation. Appreciation to all of you, all of everyone who's presented over the whole 2 days. It's been fantastic, but it's not over yet. This is not goodbye. Don't take that as a sign off. We are going to have a 15-minute break, so please be back at 3:17 for the next fantastic session that we have for y'all. Thanks. See you in 15 minutes. It's 3:17 Eastern.
Can guide you through the steps of the PDSA. And one thing I'm going to be listening for, and I'm going to encourage others to listen for in your groups as you're listening to your peers present and maybe critically analyzing your own PDSA, is to listen for the prediction in the plan of the PDSA. So every change that we make is a prediction. If I do X, then Y will happen. If I do call reminders, people will remember and they won't miss their appointment. So underlying that prediction, there's a theory behind your change. So people miss their appointments because they're forgetting. So if you test your change and it doesn't work as you expected, your prediction isn't correct maybe, then you've gathered some really important information to be able to revise your theory of change so that you can then generate better predictions, better changes. So call reminders didn't work. People weren't forgetting, it turns out. They just didn't have access to a vehicle, or maybe their childcare fell through. But when we tested the change, we found this out. So now we have better knowledge about our system and we can make better predictions. And this is really what makes PDSAs such a powerful learning tool in your improvement work. Excuse me, getting over a cold. So I hope as you're listening to your colleagues and reviewing your own PDSAs, you can really look for that. And with that, hopefully 3-minute or less intro, Jandria, we can move into the breakout groups.
Thanks so much. Yep, and that's just a visual of the plan that Christina mentioned. So yep, we're going to open up the rooms and y'all can go ahead and join your room. If you need help, we can direct you to the right room.
Okay, so
sorry, not to. Perfect. Thanks, Asia. All right. Well, I hope y'all had a nice chat with your coaches. I hope nobody got cut off mid-sentence this time, although somehow I suspect they might have still. We really are trying with our time management, you know, and trying to get as much out of each session as possible. So without too much, ooh, did someone want
Yes,
to chime?
me.
Yes.
I don't know if Kate's back in the room. I just want to apologize. You were midstream and you got cut off, and we will get back to you. I mean, keep that thought because it's important.
Thanks. I was just saying, I hope no one got cut off mid-sentence. So there you go. Someone did. But yeah, I encourage everyone to keep an eye on the time. Obviously, the facilitators are really keeping an eye on the time, but everyone should be able to see the time left in the Zoom breakout room. You know, I know it's never enough time, and we do hear your feedback on that, and we will try to adjust things the next time around. So without any further ado from me, I'm going to turn it over to Kamisha, who's going to talk about the way forward and some important information about what's coming up now between this learning session and the very end of the collaborative. And then I'll see y'all again just before we adjourn.
Okay, you can go to the next slide, please. So moving forward, so we're coming down to the end of this session and then almost a collaborative, right? So between now and our next time together as a group, Learning Session 6, which will be in person, just some quick reminders about our reflection session that will be happening this month. Look out for the emails and reminders, invitations, as well as our coaching groups. Our coaching groups will continue to meet throughout the month from March through May. And again, reminders and follow-ups will be sent accordingly, and also pay special attention to those affinity group calls that you are a part of, to be sure that you're joining those as well. The PWH Liaison Affinity Group call will continue to meet. That will be meeting monthly on the third Thursday of the month as well. Data submissions, just keep note of those as well, the March 15th and May 17th deadlines. And again, reminders will follow as always. Next slide, please. So when we meet in person in June, we will be asking you all between now and June to create storyboards. And if you've been part of our collaborative space before, or if you've done it in other projects, you know, this is a way of telling your story, your journey thus far on the collaborative, within the collaborative, your QI journey. And so it's just a visual display of your QI efforts. And it just provides a quick snapshot of what you've been doing. And the next slide will show us how we can break it out. And so this template is what we will send to you all, your all sites. And each of these boxes that you see is a different PowerPoint slide. So for example, the rationale and background, which is in the top left, that'll be its own slide. So you'll have the opportunity to write down some information. You write down your aim statement, different data, and visual. You could use different charts to show your data, talk about lessons learned, talk about your team, and definitely make your poster eye-catching, right? Make it stand out, put a title, your logo, all that good stuff. And again, each and every one of these boxes are a different PowerPoint slide. So you'll be able to create your content in the in PowerPoint that we'll share with you, the template. And then on the next slide, you will see an example of what it would look like. So this is from an End Disparities Collaborative, and this agency shared with us, their journey across the collaborative, right? And all of those PowerPoint slides that I talked about and that template that was in the previous slide is going to look like this. So it's not for you to put it together, so don't panic. You will send us back the slide set, and then we at CQII will go through and create this storyboard for you. This format, I should say, put it in a format that you see here, and it'll be Impact Now logo and all other things you would want to include for your agency to tell your QI journey, your story. Next slide, please. And so again, it's just a gathering of your information, some background data. The slide template will be shared and you can work on it over the next few months with feedback from your coaches, feedback from CQII staff. So it definitely will not be a last minute ask. You'll be getting that sooner rather than later. So you can start to just think about some ways and some things that you want to include in your story to share with others. We will review it and give feedback before we do the final conversion into the storyboard. And we will print them all for you all so that we can see those lovely boards on display, whether at Learning Session 6 or at your respective agencies. Next slide, please. And again, just some quick tips here for sharing your information, your data, your journey. Make it fun, be creative, but also be clear to the point. So that if folks read it, they can see, okay, a quick snapshot of what you worked on. They can see your way forward, any challenges that you may have, include everything. Tell a full story here, but in a way that's succinct to the point and captures your efforts. Whether they are, you can see the progress. There've been some challenges, some setbacks. Those are things that can be shared as well, should be shared as well, because they'll be part of the learning experience and a journey for others, and even your team as well. Any questions or comments before we any questions or comments? I want to leave that open for. I kind of ran through it quickly, but again, over the next few months, we will be sure to revisit this within our coaching groups so that you can get a sense. And if there are any questions, again, feel free to bring them up during your sessions. The office hours encourage you to attend and ask questions as need be. If you need time to work on it and you want to designate that time, definitely come and we will work through it together. And we will be providing feedback and different versions, I'm sure, will be developed, but we'll work on it together to make sure that it's ready for Learning Session 6 in June. Any questions or comments around the storyboard or next steps? None?
I kind of want to put someone on the spot. I know Sun River was in one of our collaboratives before and did a storyboard. I don't know if anyone from the Sun River team who's on right now was part of that, or if there's anyone else on right now who's done a storyboard that maybe wants to talk about what that process was like for them, or any tips or ideas, for new folks who haven't done a storyboard before, who are seeing this for the first time. I know if Lisa Reed were on, she would be unmuting, but unfortunately, she's no longer with the organization, I think.
I've done this as a collaborative participant before, and I will say that most of this you've already done. So don't stress about it. We've been building up towards this. You already have a lot of this in place, so please don't reinvent what you've already done. We've hoped we've kind of taken you along the journey and asked for different pieces through each of the learning sessions that you can then input a lot of what you've already done into these slides, and putting them into the PowerPoint slides really makes it quite simple.
Great point, Julia. Thanks for that. Yes, definitely don't try to reinvent anything or come up with it. Stuff that would have already been done, just highlighting your journey and your work thus far.
Yeah, that's another great point, Jamie. Delegating, right? Try not to be a team of one in this. Right. I also want to leave a little space, but if there's nothing further on this, then I will also keep it moving forward. So just in terms of wrapping up as usual, we would like to ask for you to share. I know it was a quick, abrupt end to the very last session, but if you can kind of think back over today and yesterday, if you'd like, any aha moments, anything you heard that you're going to take with you, anything you shared that you think people appreciate it, or I know we were showing a lot of love for some of the shares in the main room, but anything from the breakout rooms that you want to share with the larger group, we'd love to hear from you.
Hey, Andrea, may I say something?
Yes, please.
So my aha moment, pretty much as I share with our, group, is standardization. It's a word that, as was mentioning in our group, many of us resent somehow because we have our own unique styles of, doing our work. And when someone brings from outside other ideas, and someone was saying right now in the chat that it's not about reinventing the wheel. Technically, we didn't reinvent it. What we were doing, we just incorporated into our, style, something that came from the CQII, that our representative here, Berlinda, brought in our supervision meetings. And so after that aha moment, it just translates into us coming all together. We have been a team all along. But when it comes down to this specific task for our case, it is the case conferences with the doctors. And our numbers were never up to par. Now they are, thanks to this.
Thank you, Marcos. That's a great share. And I saw Julia, some other folks doing applause. So that's really, thank you so much for sharing. I think that's a great note. I see other folks in the chat. I just want to know more about this. Kara, would you mind unmuting? I love this quote. Can you just tell us, is that something you said or that you heard?
Sorry, no, that was something somebody said in one of the sessions when I was speaking about training staff and providers and trying to make it more user-friendly. And Jane said it, I think. What's your pain point and how can I be your aspirin? And that also goes with something I heard somebody else say, don't present a problem without a potential solution.
And I got that quote from someone else, so I stole it in the first group and shared it in the second.
Nice. Do you want to footnote where you stole it from, or no?
Don't remember.
Don't remember.
But they can speak up.
Yeah, we do say steal shamelessly, so
I stole.
I'm all about it. No, I've heard the what's your pain point, but I never heard the second half of it. I've never heard
that is my half. How can I be your aspirin? Yes.
Okay.
That part's mine.
I love that part. That one's definitely new to me as well. Anyone else feeling a bit braver now that some others have gone?
I was thinking about something.
Thanks, Alex.
Heard someone say they would have an off-ramp options to question a process for unique circumstances. I never thought about, because we do want standardization, and it is, consensual that we do that for everyone to do the same thing, but we always have that special one-off. So that's something I definitely want to see about probably implementing, so we do have a quote-unquote off-ramp for our unique situations. And I forget where I got that from, but they could speak up and greatly appreciate it.
I feel like that was Angela, but I may just be attributing it wrongly. Angela, was that you?
It was me, and I off-ramp with the utmost caution on this very busy highway. But if you don't build an off-ramp, people are just they're gonna sneak around it anyway. So you might as well build it into your process so they have a mechanism for when they need to deviate. Not if, but when.
Thanks so much, Angela. Yeah. And again, we really do try to foster this peer sharing, even in this virtual environment. So it's really nice to hear, that y'all are learning from each other's wisdom. Thanks, Evan. I see you in the chat too. And that your thought might be somebody else's aha moment. So please keep sharing and learning. All right. So now to another follow-up question. Our next question for you is just about kind of anything that particularly went well or we should think about doing differently going forward. And it's okay, meaning going forward at a future learning session. It's okay even if something was said yesterday, you can say it again today. Just means you feel really strongly. I know we also internally had some ideas of what worked well and what didn't work well. So anyone, coaches, everyone's welcome to chime in here about what you think worked well or things we might want to do differently going forward.
I think, Denise, I think what's working well for so far still is the constantly outreaching and the way you're outreaching, the steps that we are taking, 3 phone calls, no answer, letter sent out. After letter being sent out, you're gonna follow up with the pharmacy. After the pharmacy, you're gonna follow up with the emergency contact. So I think that's working well, so far, that's working, with trying to find out where the patient is at. So I think that's one of the good things that's working.
Thanks, Denise. And that's bringing our focus back to the actual patients, which is great that we serve, right? We're kind of thinking about the collaborative part, but I appreciate you kind of bringing it back to the actual day-to-day work that we're doing, trying to increase viral load suppression. So thanks. I see some nice comments in the chat too. Excellent. All right. And anything that really isn't working well for you, again, we're not fishing for compliments. It's nice to hear, but we really do want to know any ideas that you have for changes. Very happy to hear them in a group setting. Something you say might spark someone else. If folks would prefer, they can also send us an email, let us know.
Well, I wanted to just say what has worked well, and I've always been a fan of the breakout sessions, like the time that you guys take into creating new and innovative breakout topics for us to discuss amongst each other. It's never, ever boring or lack of topics to talk about. So I think that's really great. And just today, how you guys modified so quickly with a little hiccup that happened yesterday, I think your team collaboration is great.
Thanks so much, Berlinda. We really appreciate that.
Yeah, I want to agree with her also. You guys came back strong.
Thanks, Denise. All right. Well, on that note, then I think I'm going to go ahead and launch the poll with the questions. They are very similar to yesterday. Hopefully everyone can see the poll. I know it might have been a thing with phones. But the poll is open. You should be able to see it. Please let us know if you're having any trouble seeing it or answering the questions. There are 4 questions. And we really do use your responses to try to improve things going forward. So please be honest. We also may follow up by inviting you to a focus group at some point or to a design meeting for a future collaborative. I don't want to pull us in too many directions. I really do want people to be able to focus on those questions and answer. So I'm just going to give it another minute.
Thank you.
Mhm. All right, I don't see any other activity. It looks like folks have finished up. Has anyone not been able to answer yet that would still like to answer? If so, please unmute and just let us know. I can leave the poll open, but if everyone's done, I'll go ahead and close it and get it out of your way. Anyone? All right, I'm going to go ahead and end it. We can always relaunch if anyone missed it. And just very quickly share the results so y'all can see. Got some feedback on how relevant the topics were. And again, we're happy to hear from you if there are other topics. We do try to share the agenda in advance. So if there are things that you don't see on any of our agendas that you would like to see, please chime in. We're very happy to co-design. How likely you'll be to use the information. We know it's obviously a lot of information, so some information may be more relevant or more likely to be used. How you would rate your level of participation. Hopefully everyone can see what I'm seeing. I trust someone will chime in if they can't see it. Your own participation. And again, we know that can be for a variety of reasons. So we appreciate your honesty on that. And just sort of how excited you are about continuing on the journey. So that's also nice to know the majority of folks are happy to keep going or even super stoked. All right, I'm going to stop the share. All right, so just wrapping up, we covered a lot of ground over these 2 days. I mean, I think you can obviously see our theme was really about communication, whether it's through data visualization, through knowing your audience, as well as sustainability. Again, starting to think early on in the process, even earlier than we are now, but really taking time and focus on how to sustain these gains. So we appreciate everyone's time and attention over these days. We know it's not easy to block yourself out from all of the other activities that are going on in your organization for 2 days in a row for about half the day, through lunchtime, through all those things. So a sincere, genuine thanks from all of us to all of you. And just to what comment or add on to what Berlinda said, I think one of the reasons that these breakout sessions are so engaging is because of all of you, all of the participants who are sharing. So we appreciate you all and we thank you. The only other thing coming up this month are the reflection sessions. You should have already been invited to attend one of those. If you cannot attend the session you were invited to, we have other ones. So just let us know and we will find another day and time for you. And then back to our usual routine of coaching calls and office hours in March, April, and May. And our next learning session in person together again at the HRSA headquarters, June 6th and 7th. You should already have a calendar invitation in your calendar for that. If you don't, please let us know. You can reach out to your CQII support person. So that would be Asia, Ali, Nicole, or Michelle, depending on which coaching group you're in, or me. You can always reach out to me, and we'll be happy to make sure you have that information. So from all of us to all of you, sincere thanks. Yeah, thank you so much and have a great day. And we will see you online soon. Any last words? I feel like Denise wants to unmute. Did you want to say something, Denise?
No, I just want to say thank you and I enjoyed this and I'm looking forward to June.
Thanks so much, Denise. We really enjoyed having you. And thank you a special thank you to all of the panelists who shared and everyone who shared throughout the course of the learning session. Thank you all so much.
And Denise, we appreciated you.
Oh, thank you. I appreciate that.
Nice to meet you.
It's nice to meet you too.
Have a good week, everybody.